Hi, my name is Susan, and I live at Pelican Preserve, and I found Dr. Davis on Facebook, and it made sense to me what he was saying. So I thought, well, let me give him a chance. Let me go in, and sure enough, in my my X-rays, you could see that my back, which I hurt my back in my early, like maybe when I was 30. And then I tore the cartilage in my knees. And then next thing I know, the older I'm getting, the more everything is just hurting and hurting. And I was getting like stiff like a board. I could barely move. And we're about halfway through the treatments now. And I am just moving so much better. And last night at Pelican Preserve, every Tuesday night, we have music and dancing, and I would have to be so careful when I was dancing, you know. And last night I could really move. So I don't know what he's doing. This guy is just like got some great ideas, totally new, and I just feel like you can get shots or you can take medicine, and yeah, it relieves the pain, but do you really fix the problem? What's causing it? And that's what he addresses. What's causing the problem?
And how are the stairs for you now,
the
Susan?
stairs. Let's not forget the stairs. Yes, how slow I would go down the stairs. And now I can kind of really move. I mean, I'm so much looser. I was so stiff. I can't believe it. And he gives you lots of exercises, but gotta do them.
So what would you tell other people that have the same problem as you?
You should come in. You should give it a try. This is like something totally different. I never had anybody adjust my knees like that. I've gone to other chiropractors, and I just think it's so neat that there, you know, every occupation, I do hair, they're always coming up with new and better. And I feel like that's what he's done. He's come up with something that's better than, you know, the old way. In fact, I was talking to a lady here a couple days ago. She drives 2 hours just to come and see Dr. Davis. Pretty impressive. Okay, that's for her back, so he must be good with a lot of things. Okay.
Thank you, Susan.
Thank you.